Hi.
Hello everyone. Good morning, good afternoon.
Good evening.
I wanted you to feel I wanted you to feel to say something.
Whatever time you're watching us, this is our midwives reality show.ke. Give us your name.
I'm Mary Guru.
My name is Evelyn Kewa. We're back again, but before we start our topic today, what do they do, Mary? They
Subscribe.
Yeah, please subscribe to our channel. Take us to the next level.
Sure.
Yeah.
Guys, comment.
Please comment to us.
If anything,
Content.
if anything we are doing good,
Yeah.
say girls, you're doing well.
Yeah.
If anything we need to improve on,
Please
don't
tell us,
shy
yeah.
away.
We
are
are
here
still
for
young.
you.
We're still young but growing.
We are still here for you, yeah? So
Yes.
kindly tell us on our comment section.
Exactly.
Don't shy away. Positive, negative.
Yeah. Please tell us so that we
Please
can
take
improve.
it. Yes.
But we don't take your support for granted. We appreciate every bit of your support. For those who are returning subscribers, thank you so much. For our new subscribers
who is stopping over, karibu sana.
Yes. So today we are going to tackle an interesting topic. Is it interesting?
Is it really interesting?
I don't know.
Where? Guys,
our topic today, I don't know what to call it, but it's a good topic.
It's a good topic because everyone, okay, not everyone, but most mothers have it and undergo it.
But they have come out strong.
Yes.
Yeah.
And those are small marks that makes you a proud mother.
Yeah, those are small marks that make you a mother.
Yes.
Those are you hear when they say you get a bundle of joy.
Yes, it comes with its own bundles of.
Exactly. It has its own issues.
Yes.
So today we are going to tackle about a care of perineal tears and
episiotomy.
Care of perineal tears and episiotomy. Now, before we start, we need to understand what a perineal tear is. Yeah.
Maybe. Guys.
A perineal tear. A tear. Yeah. A tear is an...
These are tissue trauma.
Yeah.
That happens on your vaginal walls.
Yeah.
During the childbirth.
Exactly.
Yes.
Or an injury.
Yes.
Remember, a tear is never expected. It's something that comes.
It comes, but it is not like it is unexpected.
There are people who survive the delivery without a tear.
Yes.
Yeah.
So you can either have or not.
So this one happens on its own.
Yes.
It happens on its own.
It's not the medical care professional. Exactly. I mean, attendant who inflicts it to you.
Yes.
But it just happens. It's unavoidable on its own.
Exactly.
Yes.
Now, an episiotomy. So we need to get the difference between a tear and an episiotomy. So a tear, we've known that it's an injury that happens on its own during childbirth.
Yes.
Or a tissue separation or tissue trauma that happens on its own. Then an episiotomy, it's something intentional.
It is intentional.
Yeah. It is a cut that is given to the vaginal opening during childbirth. Is it true? Am I right? Yeah. This is a cut. So it's normally an intentional act that is done by a care provider.
A care provider.
Yeah. So what makes a tear? Okay, I would ask for a tear. An episiotomy is just an episiotomy because we cut.
It's a cut.
We cut everywhere.
Not everywhere.
No, I mean the layers.
Yeah.
The layers.
You cut.
You cut the layers, but to a certain...
Intentional layers.
Intentional cut to a specific area.
Yes.
You cut all the layers of that area. For example, if this is the wall, you cut everywhere. That is what I mean. But for a tear, it might decide to choose just a few layers. For example, it chooses the skin and maybe the layer below it. Yeah. That is how they are classified because you have 4
layers.
Four degrees of tears. That one will come later We'll discuss about them later. But today we just want to understand what makes a tear or a perineal tear more likely to happen. Why do you think a perineal tear happens?
It happens due to the pressure.
Yeah.
From the baby, like you can see from my balloon.
Yeah.
Yeah.
That pressure is the baby's head.
Assuming this is the baby's head.
Yeah.
Oh, my balloon is torn.
Don't worry, that is a tear.
Right. So, as the baby is coming down,
yeah,
the muscles,
they weaken.
They weaken and they can give
way.
Yeah. Mostly for first-time mothers.
So that is one of the topic. That is one of the points that will make a tear happen. If it's your first time, baby.
Yeah. If the baby is big, because the pressure will be more.
It will be more. Yeah.
If the baby is, and big means in relation to your
pelvis.
In relation to your muscles now here.
Outlet.
On your outlet, yes. And also if previously you had a weak area, like the previous delivery, you also had a tear or an episiotomy.
So it leaves the place weakened.
Like you can see my balloon is already giving way because it was already torn.
Yeah. Although it was sutured previously,
the area is more, it's weaker.
Exactly. Not like a place that has never been sutured.
Yes. So it can
give way.
It can give way. When else?
Maybe when the baby is big.
Yeah,
we have said about a big baby. Yeah. We've said when the baby, when you're first time mother. And then when there's a malposition also. Yeah,
because when you have a malposition, like we talked of on the other topic, when we talked on the other topic, if the diameter of the baby is so big, this baby will come out like, it will put a lot of pressure.
Exactly.
If this baby is not facing this way,
the baby is facing this way?
This way, yes.
Yeah.
Like this.
That is a malposition.
This is a malposition.
Remember, it will increase the
diameter. So, it will apply more pressure and there is likelihood of you getting
a tear.
Exactly.
It is not to scare you. Tears can be repaired.
Definitely, yes.
Tears can be repaired.
We are here to give you hope. Come on. We are girls of hope.
So a tear can be repaired and you can go back to your normal.
You can. You will go. Even you can be better.
And then a tear is also likely to happen when there is use of instruments during delivery. Although most of them have been phased out nowadays. But there are some people who still use them.
Like Q5, there is the forceps delivery and Kiwi.
The vacuum. The vacuum delivery. Those are assisted deliveries. You'll have to get a tear because there is increased
chance of meandering. You need more space. So now, as we say, that is tear. Again, the same would happen if we wanted to give, the same scenario is for episiotomy. But now for episiotomy, since it's me who is deciding, me as a care provider,
I'm the one deciding when to give the episiotomy and why. Yeah.
This is not now the baby who is deciding when to tear and when to get out. But now, this time, if you're having a premature birth, and I'm seeing the baby is going to struggle, as a care provider, you can widen the way.
Maybe can we also add as an additional tear likelihood, an assisted delivery? For example, if you deliver alone, like when you deliver on the road, when you deliver at home, and there was no midwife or there was no one, you just push alone. Remember, a midwife has a very big role during delivery, and there's a way they support that perineum until they minimize the tears.
They minimize,
So if you deliver alone, you just push the baby out, there's a likelihood of getting a tear. Sorry to interrupt you. I needed to add that,
So guys, you've heard.
Yeah.
So we try to get in the hospital on time.
Yeah.
not all times that you get fine. What happens when you get to the hospital? We prevent you from getting extensive tears.
Yeah.
Yes, you may get a tear, but
Not extensive.
Not extensive.
Because others can be very...
Yeah. When we can, we are able to prevent.
Exactly. You were talking about the episiotomy.
Oh, so the episiotomy, what I was saying,
Yeah.
episiotomy is intentional cut.
Yeah.
Like you are pushing, you've been pushing. The head has been stuck there for...
The head has remained there for some time. Yeah.
So my next role is just to widen the area.
So that we get the baby out.
So that we get the baby out. Or when the baby is getting distressed. What do I mean when the baby is getting distressed?
Maybe we are getting a low heart rate. The baby is not...
guys, by now you know what is a
tachycardia and what a bradycardia is.
Now you must be... we are at par, yeah? But for the new
viewers, a bradycardia is a low heart rate, below 110 beats per minute. A tachycardia is
above, which both would mean fetal distress.
A baby is not happy in the tummy.
The baby is not happy in the tummy,
yeah.
So you need to hasten the delivery. So you can also do a small cut and widen the area, and the baby is able to
be delivered as
fast as possible.
Exactly.
Another one is also a big baby.
Yeah.
Big baby you're pushing, but instead of allowing you have an extensive tear, I decide to give you a small.
That is a big baby who has just been noted that the baby is big during that point. Yeah.
Or a malposition.
Yeah.
And we have, sometimes of this malposition, you notice the last stage when you
can't do anything.
Or now it's deliver.
Exactly.
Like you have no other option.
Yeah.
So those cuts are made.
Yeah. So you had talked about a preterm baby. Can cause
preterm baby. You cut the mother to avoid more pressure on the baby's head, because the head is not well formed.
Yeah.
So you want to prevent
more torture.
Or to give more torture. You want to give the baby a good room.
Exactly. So guys, having known why we get a tear and why we should give you an episiotomy during delivery, I think it is high time we know how.
You see,
our baby is not dead. It is the high time we should know how to care for our episiotomy or our perineal tears, which are already stitched.
Yeah.
See, they're already stitched.
After delivery.
Yeah.
Depending with the degree.
Yeah.
First and second degree,
those are okay.
Are sutured in the unit, most of the hospitals.
Yeah.
Third and fourth
are a bit tricky.
You may, depending with where you are, you may be taken to theater.
It's a minor procedure.
Yes. Which needs to be rectified.
Exactly.
So you'll be taken to... You may not,
depending on the expertise of your doctor also.
And the facility, the availability of these things.
Yeah. I think we as viewers also have a role, or as mothers who have delivered also have a role to know what I'm supposed to do to my perineal tear or to the episiotomy.
Now you have been...
The self-care.
You have been repaired.
Yeah.
Back to the units. You are breastfeeding with your babies here. Now how do you deal with that?
I think the first and foremost, you should understand that why it happened.
You have understood?
I have understood it has happened because of this and this
and you have appreciated.
And I've appreciated it and I've accepted. Now, it is my role to keep that place dry and clean. Dry and clean, I mean, always when you go to the washroom, ensure that after what you're doing, for example, if you're passing urine, if you're passing stool, ensure that that place is left clean. Remember, most of our setting nowadays, they use toilet paper. I don't think it is allowed to use a toilet paper on the stitches. Just wash off the area and then tap it dry with a cloth. That one will really help. and it will keep the place very clean. Number 2, that place, you also need to, I know it is painful. I remember when I first started my practice as a midwife, the doctor I met first said, if you sit on the stitches, they don't swell.
You put pressure. It's just like the way we say, you've cut yourself, apply pressure.
So try and sit on them, but I also, it's controversial. If you put so much pressure on it, it is painful. So you can change positions. Just don't sit the whole day. You are literally seated on a wound, and it can be very uncomfortable. Number 3, you can also, for the pain, you can also use ice packs or
when
cold
it is so
compress
painful.
when it's so painful.
Especially when it is fresh,
Yeah.
after the lignocaine or the local anesthesia wears off.
Yeah.
By the way, guys, I didn't tell you, when you're being repaired, it's not done like newt. You are
You're
under
given
something
to-
killer.
yeah.
So don't fear. It's done under some local anesthesia.
Yeah.
It's actually not painful.
Yeah.
So when now the local anesthesia wears off, if it takes time before you get some painkillers, sometimes it may hurt here or there.
Yeah.
So you can apply some cold compresses. That you can have some ice packs.
Yeah.
You put in a balloon like this.
Or you put it, or you wrap with a towel.
Or you wrap with a towel.
And then
You
you
just
just
press at
press.
that point.
Exactly.
And the pain just
It disappears slowly.
just disappears slowly.
Then it's a business when you have a cut, when you go to the toilet and you find yourself constipated. Remember, that cut is made in between the vaginal opening
And
near the anal area. Those when you're constipated means the stool is hard. You go there, you try, you might even make the place bleed. So when you're in the hospital and you feel like you need the drug to help you soften the stool, ensure that your doctor is also aware. But if you can manage with diet,
which most people have done.
yeah,
So like you eat high fiber diet.
exactly.
A lot of fruits. Remember, we are taking a lot of fruits for our baby.
Yeah,
And a lot of fruits for to prevent constipation.
exactly.
So that can work.
Exactly.
Yes.
How about what do I say? Okay, you see, if I have a baby, there must be a partner. How long do I take to get back to my sexual life?
Well. You know, to become active, to go back to become active back in bed,
Yeah,
you need a bit of time.
yeah.
Don't go back soonest.
There's a wound.
There's a wound,
Yeah.
so give it more time to heal.
Yeah.
Until
Yeah,
at least the sutures that we use currently,
yeah,
they are self-absorbable.
yeah,
So they will not go for removal.
yeah.
Within 2 to 3 weeks, they will have cleared.
Yeah.
You know.
You want to tell me 2 to 3 weeks?
No, I'm just saying for the sutures to be
Absorbed.
But I didn't say the wound has
Healed. I think it's individual.
Everyone takes different timings, but after 6 weeks is much better.
Yeah.
Because even you'll have chosen a plan.
Exactly.
A family planning method.
Exactly.
So I think that would be the best time
to resume back to your
back.
normal
Yeah,
self.
but I know there are some tribes. I'm not disputing
Exactly.
with what people do, but as a woman,
it is
I
also
would
good to study
feel-
yourself.
I would feel better after, because these things we do for pleasure.
Exactly.
So when I'm doing with a wood and it is inflicting pain on me,
Then it has no
then
point.
it has no purpose.
Yeah.
Because definitely for this time,
Yeah.
it's not for reproduction. It's
It is
for the
another
pleasure.
culture or
It's for pleasure purpose,
Yeah.
which me, I'm not going to enjoy.
exactly.
Right? So me, I think after 6 weeks,
You're good to
if you are comfortable, you're the
go.
ready.
You're good to go.
You're good to go.
Thank you. Now, the hygiene.
hygiene number 1. How do you change your pad?
Yeah. How do you wipe yourself? Although we said you're not wiping, but how do you clean yourself once you're done with your washroom business?
How you change your pad first? It should be front to back.
Yeah.
And the same way is the same way you clean. Like, you don't pour water when you're bedding
Because
to clean the front.
It will on the front.
Yes. If you're using a bottle, just
use from the front
area.
Yeah.
Not from the back.
Yeah. And even on a normal circumstance, even if you had not delivered or you're not even carrying an episiotomy or a tear, cleaning from front to back is what is
recommended.
Yeah.
Front to back.
Yeah.
Regular change of pads. When we say regular, not more than 4 hours.
Yeah.
If it is when probably you have a lot of blood heavy flow,
yeah,
that one you should be more frequent.
You should just assess yourself, observe yourself. No, this is full. Do not reuse a pad. Once you've gone to the washroom and you feel this one needs to be changed, do not put it back. Just throw it away and get a fresh one. Then hand hygiene. Hand hygiene
before and after.
Before handling the episiotomy or a tear, because you've come from different areas, you've touched so many things. When you transfer it to the wound, it's a source of infection. And then after you've handled everything in the washroom, just wash your hands
soap
again.
And water.
With soap and water.
Don't just say you've washed and you have only used water.
Yeah.
It's soap and water.
Yeah.
Guys, another thing is the exercises.
The pelvic exercise.
Yes.
Pelvic floor exercise.
Yes. Pelvic floor exercise. How do you do them? The Kegels.
Yeah.
It's
hold
the urine, like you're holding the urine
for some time.
Then get to another level.
Yeah.
First.
Yeah.
Second. And third. Then release slowly. Then repeat a cycle of 10 times.
You can do it even every day.
You can, and you can do anywhere.
Anywhere. No one will know that you're doing a Kegel.
This one not only for the mothers who've delivered,
but for many.
For many girls, for us, all
everyone.
of us. Yeah, it helps to maintain those muscles.
The muscles become
more tough.
How do I air my stitches? Because I understand that, because if I leave the place so enclosed, then how will it get air? How will it dry?
A postnatal mother is supposed to rest.
Yeah.
Right?
Rest is a recommended.
It's very key. Like we did that video previously where we were talking about rest for a postnatal mother.
Yeah.
As you are resting, you can just put a towel on your bed.
Yeah.
Leave your legs open and without a panty or a sanitary towel.
Yeah.
That makes the area more aired.
More aired, and it will dry faster.
Yeah, and it heals faster.
Because
you remember the pad itself has some moisture, has some warmth.
Yeah.
So it makes the place, and the place is very enclosed.
Yeah.
But if you leave the wood a bit open, it gives
just
it
lock yourself somewhere and lie on the bed without any clothes. Then the place will be aired.
Sure.
I know this might sound weird.
No. It's done. Then there's another one I've just remembered.
Yes, please.
There are those mothers who are given creams.
The antibiotic creams.
The antibiotic cream to apply.
Yeah.
Do you know most of them come back with infection?
Why?
Because they just keep applying without cleaning.
So you apply without cleaning. And it's written very well. You clean first, tap dry, and then you apply
afresh
when it is dry.
And how do you clean this episiotomy when you're at home, or this tear? How do you clean? You just use the normal way you've been doing your that area.
Yeah. The way you clean that place has not changed.
If you use soap, just clean. Make the place clean.
Yeah.
The word is
clean. Yeah.
So if you have been using soap, continue. If you have not been using soap, continue. But if you have been scrubbing like 2 times, now do 4 times.
Yeah, scrubbing.
Like you've been cleaning the place.
Yeah.
Like you do like this.
Yeah.
And you think the place is clean.
It's okay.
Now next time, if we have a tear, you do 1, 2, 3, 4.
Exactly.
Yeah, and now the place you are more assured that it is clean.
It is clean.
So the key thing of episiotomy and tears is to keep them clean.
Exactly.
You will hardly get an infection.
I also think, okay, in the past, when I was young, I used to see people go to hospital with basins, and then when they come, they sit on salt. Is it still recommended?
I would say yes, no, depending, because it all depends with the type of sutures or the type of strings used to stitch.
Yeah.
Depending, most of the hospital are doing away with those ones that would only absorb if you use salt.
Yeah.
Because the current ones, if you use salt, they tend to
come out.
Come out before the wound heals.
Yeah. They enlarge, and then when the holes become bigger, the suture
comes out.
Yeah.
So kindly do as you are recommended by your practitioner. Because it's very controversial, not very controversial, I would say.
Yeah.
It all depends with which institution are you in.
Yeah.
If they're using what you used to call catgut, then you need salt. If we are in the absorbable vicryl, then you just continue with your normal way of cleaning.
Yeah, just observe a hygiene and everything will work well. Now, I know with the prevention of infection, balanced diet is well recommended and it's key. Now, during this time, I think some people might think a tear is just a wound and it will heal on its own. A tear can really get complicated if you don't take care of it. And you can imagine if it gets complicated and it is inside, it can be very embarrassing. So what you do, just take in balanced diet. Balanced diet, I mean, have carbohydrates, have proteins in plenty, and the vegetables. And then you can take fruits and a lot of water. I don't think that there is anything I've left behind.
No.
So if you take that, and you take that every meal, it should not be very expensive. As we said, protein can be from cereals, not necessarily meat.
It's anything that you can afford.
Exactly.
I mean, depending with where you are.
Yeah, anything that you can afford and it is in the class of protein. Anything that you can afford and it is in the class of vegetables, take. Then don't forget to take fruits. Don't forget to take a lot of water, and it will help with our...
And vegetables?
Yeah.
Because vegetables, they have a lot of fibers.
Yeah.
And fibers are the ones that are going to help us with constipation.
Constipation.
Yeah. And then we have a few points for you.
Yeah.
At what point should you be concerned about your episiotomy?
Exactly.
At what point would you think, well, I don't think I'm not headed in the right direction?
Yeah.
It's when you find the wound, maybe after like 4 or 5 days, the wound is oozing some pus.
And the pain is not reducing.
Yeah. And then when you look at it with a mirror,
girls,
how we mirror ourselves.
Yeah. No, it's good you tell them.
Yeah. You just put a mirror under your legs.
Place your mirror just ahead of you. Or,
yeah. You can decide to stand and legs apart.
Yeah.
Or you sit and then pat your legs, then use a mirror.
To check how you are doing. Yeah.
That place you should only see the stitches, no white whatever. Patches on that wood. It should not be red.
Should not be oozing.
It should not be red.
Exactly. And then you can tell a place that is not okay.
And then probably you get some fever. That is a point to go back to the hospital.
And also, if it's not smelling very well.
Yes.
If the smell coming out of there is not a good smell, then it is something to get concerned about, meaning our wound is getting infected. Yeah.
Yes.
So, with those few things that we've managed to say, Mary, anything you can add?
Nothing. But girls, let us abstain up to 6 weeks so that we are safe and we are able to enjoy these things.
And if my culture is allowing me after 1 week or 2.
Fine, you have no cut. Well, you can have it, but with a cut.
With a cut is not easy.
Just for the sake of you healing.
Exactly.
Girls,
let's heal fast.
Let's heal fast.
Let's heal fast.
Yes.
Yeah, anything you've left behind, our viewers, please? We need to understand where you are watching us from. We are still on the Midwives Reality Show.ke, giving you the best. Yes, today we had that interesting topic. That is the one we were saying we don't know what to call it. But I hope we have really educated you. We hope it was educative.
Sure.
Yes, so...
But girls, cleanliness down there.
Yeah.
Cleanliness is secondly to godliness.
Yeah.
Now this is very practical.
Exactly.
Actually, if you don't keep that place clean, things may go wrong. Yeah. And by the way, cleaning the stitch directly doesn't hurt.
It's not painful.
It doesn't hurt. It feels better. We forgot to tell them
that if the pain is too much, I think taking a painkiller is also not bad. I know with if delivered in the hospital, you got a tear there, maybe we give you an episiotomy. Then when we were discharging you, I'm sure we would have given you some painkiller. Please, when the pain is too much, don't hurt yourself. If you can't bear the pain, take a painkiller. And please don't do over-counter. Yeah, don't do over-the-counter. Because you might get something that can be transmitted to the baby. Exactly. Let you be referred by a doctor. And remember, some of us are allergic to some medications. If you continue buying things over the counter, you might buy some drugs which you're allergic to. We discourage that. So guys, with those few ones, take care of our perineal. Let's take care of our perineal. Bye. See you in the next one. Greatest commodity. Okay, bye-bye. Bye.